Hello, everyone, and thank you for joining us again on the Living Life Naturally podcast. I am, of course, your host, Lynne Wadsworth. And just as a reminder for you beautiful ladies out there, check the show notes so that you know all about what is in my community and what's there for you to take, some free stuff for you, and of course a free consult with me. So check it out. But today I'm super excited to have Dr. Prudence Hall with us. Now, she started as a traditional gynecological surgeon, and she transitioned her career to focusing on regenerative and integrated medicine. And as the founder of the Hall Center in Santa Monica, California, she saw a critical need to address the problems confronting men and women experiencing the stubborn and often debilitating symptoms associated with aging. Her practice is focused exclusively on regenerative medicine, looking into the root causes of conditions and diseases rather than simply treating symptoms. We know this is a big one for us here in the United States, especially because everything is driven by Western medicine. So this is really great. And she strives to help clients achieve optimal health and actively prevent disease without the use of pharmacological drugs when appropriate. And as a health consultant, she strives to help clients achieve optimal well-being and actively prevent inevitable decline using proven natural regenerative methods. And she's also the author of Radiant Again and Forever. So welcome to our podcast, Dr. Prudence. We appreciate having you here today.
Well, thank you, Lynn. Such a pleasure to be here. So happy to talk to your clients.
So we are going to talk a little today about aging. So especially when it comes to women in perimenopause, menopause, or even post-menopause, it all of a sudden becomes a big topic for us, or something that can keep us awake at night when we think about all of the changes we're seeing. So tell us a little bit about really why you got into this line of work, and then how you can help people with this aging with radiance specifically.
Well, when I graduated from my gynecology residency at USC, and I was at the big county hospital, so I saw the most severe diseases, the most difficult surgical cases, difficult deliveries. And I went into private practice in Santa Monica, and I thought that I really knew how to be in service to women. I was pretty confident at that point. And when I was starting to deal with my menopausal patients, they would come back and tell me 6 months later, which is when I was generally having them come back after the first treatment, they'd say, "Prudence, this doesn't work. This is horrible. You have got to fix this. I can't stand this." And it's like, what do you mean? And they'd say, "This is, nothing's been changed. Maybe the hot flashes are a little less." And so I started getting this feedback and realized that in spite of the really excellent training I'd received, menopause had been ignored. Yes. And I had gone to the menopausal clinic and, been working in the menopausal clinic. And I started searching for better options. And at the time, this was back in 1982, I was using Premarin and Provera, which is a pregnant horse's urine. It was created in the mid-1940s. And, it seemed like a good therapy. Right. And I realized very quickly that it was not a good therapy. Now, very fortuitously, I was going back and forth between France and the United States at that point, because I had done a number I did an MA in France, and I actually married a Frenchman. So I was going back and forth, and I realized they are starting to use these things called bioidentical hormones. And I did tutorials there and learned, and also in Germany. And I came back with that knowledge and started treating my women in menopause with these it's a natural treatment because it's using exactly the same hormones as our body makes, unlike Premarin that had 35 different hormones in it, and they were horse hormones, which is really tragic to use horses for that reason, but it didn't work. And women started being happy. and telling me that they were sleeping and that their moods were light and they got their sexuality back. And it was just so joyful for me to see that this was working. And then it just expanded out from there, Lynn. It just, just I'm a lifelong learner, and I think that's one of the keys to staying youthful. And I just kept on adding and adding to it. And Jeff Bland was a very big influence for me. He was the founder of functional medicine. And I worked extensively with functional medicine in the beginning, and still it's the main regenerative medicine that everyone talks about.
Right.
Just a beautiful way of identifying root core causes of diseases and eliminating those diseases rather than using pharmaceutical interventions.
Yeah, I know, because growing up in England, it was not so readily available. Even now, antibiotics are not freely given. So here in the States, you go to the doctor and their answer for everything is, well, take this pill. And as we age, it becomes very difficult because we've got different things going on. As you say, when you get into menopause, really the Western doctors, their first thing usually is, well, go on HRT. And that really, I know that that's changed a bit from the days when I was first introduced to an HRT type of therapy. And of course, since then, I've gone back into more natural things. But I so agree with what you're saying, that really our Western doctors, although they have wonderful knowledge, they really have not been taught some key pieces when it comes to menopausal women.
That is true. And for me, it was like awakening from a sleep when I realized how integrated the body was and how something as simple as the gut can affect all of our emotions and our moods and our future diseases. And it just became so exciting to be able to put this together in a different way with the traditional knowledge that I have.
Right.
So I think that treating our perimenopause and really being aware of what's going on in our body is so important. And perimenopause begins in our late 30s. Women come to
Yes.
me all the time and say, I just don't feel right. Something's wrong. And it's like, what's wrong? And frequently they can't put their finger on it, but it could be, well, I'm feeling more depressed, or I feel I've gained 10 pounds and I'm doing the same thing, same amount of exercise and diet. Or, I just can't sleep like I used to. I used to be a champion sleeper, and now I'm waking up in the middle of the night. So these are classic menopausal symptoms, which menopause now is about 44 to 48. And when I started this 4 decades ago, it was really more like 50, 51, 52. So women are saying, but my doctor won't even check my hormones because they say I'm far too young for this. And it's like,
Right.
check your hormones, inform
Yes.
your doctor what you think is going on. And if they don't follow your lead and really do some of the things you're suggesting, they're not your doctor. They're just a doctor
Right.
for someone else.
Right. I know my daughter has been through this, and they just kept telling her that you're too young to be in menopause, but she's got all of the symptoms for it. And I'm like, well, I hate to tell you, but you're in perimenopause. I don't care what they're telling you. You have to go by what your symptoms are.
Symptoms, Lynn, are absolutely crucial, and especially with some of the other hormones that start to decline. So in menopause, it's not just the ovarian hormones that decline. It's very, very stressful to the body to lose your estrogen and your progesterone and your testosterone. Those three generally decline
Right.
in menopause. And so what happens is the adrenal stress glands start to, first of all, become very active, and then they plummet. So symptoms of low adrenals very similar to ovarian decline. It's fatigue and discouragement, feeling hopeless, gaining weight, feeling sort of a nervous anxiety in the body, kind of like wired and tired or just tired. So I give an extensive questionnaire to women so I can kind of start seeing what symptoms might come from where, but also I check all of the hormones. And I I love checking hormones because you
Mm,
can really, I can show a woman now, here your estradiol is less than 5, and here it is 125. And that is one of the reasons why you're feeling so much better.
mm, mm. So what happens? Let's skip forward 10 years or
Mm.
however long you're going to be in perimenopause, and you've not had periods for a year, so you know you're in menopause. What happens to a woman when it comes to hormones when they're postmenopausal? Is it still something we need to be concerned about?
Um, so absolutely. So I've redefined a little bit how I consider menopause because when I started measuring women's hormones, and I've measured, I don't know, probably millions of levels by this time because everyone gets their levels measured at each
Mm,
visit. What I realized is that women can be fully in menopause and have absolutely regular periods every 28 to 30 days. I still call that menopause when they have
mm,
symptoms and when their follicle stimulating hormone, which is a pituitary hormone, is above 20 and they have very low estrogen. So I would call that menopause, even though they're having periods. And I don't understand why my medical, OBGYN board says that there's a postmenopausal state. Because once you go into menopause, and this is kind of bad news, but also, it's a call to action. Once you go into menopause, those hormones stay low and the diseases arise as though you're still in menopause for the rest of your life. So,
mm,
what diseases arise from menopause? Heart disease, dementia, all the inflammatory diseases, autoimmunity, diabetes. I mean, you name it. And menopause is going to propel that and make that more
mm,
prevalent. So, youthful hormones, youthful body, and less diseases, low hormones and menopausal hormones, much higher diseases. And those root causes, see, when you're in menopause, I just have this little pin here. When you're in menopause, what happens is low estrogen causes high inflammation, high stress, high LDL, generally bad cholesterol. And so stress, inflammation, high sugar. So when I raise those estradiol levels and the rest of the hormones, including the thyroid, then the body becomes youthful again. And hormones are, that is
mm.
information that tells the cells in your body what to do. And some women say, well, aren't hormones dangerous? It's like, well, if you lost your hormones, you'd die almost immediately. I mean, it really is sort of like saying, is
Yeah.
food dangerous? Well, some food is not good for you and some is excellent. So that's why you want to choose the hormones that are exactly the same as your own hormones, because those are the best hormones with the greatest results. So yes, we want to treat menopause, whether a woman is 50 or 42 or 40 and all the way into 60, 70, 80, 90. My oldest patient, it was 92.
Mm,
She was developing dementia and her kids brought her in. And so I put her on hormones and her brain actually improved
mm.
significantly.
So, how do you measure hormones when somebody then is past the perimenopausal stage? How do you tell what are the right hormones for somebody?
In terms of the labs that I order, or okay, so I order the same labs with almost every patient. What I do is I look at the ovarian hormones. That is the follicle stimulating hormone. Very important to measure that because when I give estrogen, that goes down. It's the brain calling out to the ovaries saying, I need more estrogen. So I want to know what that woman's brain is
Mm,
telling us. And then the estradiol, the progesterone, the testosterone. So that's the ovarian hormones. Thyroid, I measure 5 different thyroid hormones, including reverse T3 and thyroid antibodies. I want to see if the thyroid is really functioning well. Then I look at the adrenal hormones. The 3 hormones I look at there is I look at cortisol, which is the happy hormone, DHEA, which is a fabulous hormone for building muscle and bone and sex drive and lowering your small dense, lowering your cholesterol, the bad cholesterol. And so it's a very important hormone. I look at pregnenolone, which is a mother hormone that tells me about reserve for hormones. And then I look at D3, That's the sunshine
Mm-hmm.
hormone.
Mm-hmm.
I also look at markers for inflammation. That would be a high sensitivity CRP. I look at homocysteine, which has to do with detoxification, and B12 and folate, because those are such important cofactors, really.
Mm-hmm.
People call them vitamins. And then I look at the sugar and insulin, which is one of the core root causes of diseases. So when you have high sugar, and I measure the 4-month marker for sugar damage, it's called the hemoglobin A1C. That tells me a lot about, well, they develop high blood pressure. 85% of high blood pressure is
Mm-hmm.
related to high sugar. Now, that's Mark Houston's work, Vanderbilt University, fabulous cardiologist. Also, higher sugar, Dale Bredesen, who's just a beautiful, I mean, eminent, intelligent Alzheimer's disease researcher. He says, look, this is one of the main causes of Alzheimer's disease. So I measure genes too. I measure, for example, ApoE genes and BRCA genes, and I measure methylation to see, are you really using your folate, or do you need a methylated folate? So, these are all things that make up the person. So but I started, Lynn, with just saying, oh, menopause was estrogen and progesterone. And then it's like,
Mm-hmm.
holy shoot, testosterone's important. What's this adrenal? And what's this thyroid thing going on? And oh my God, D3. Like, I was really encouraging my patients, clients, to use a
Mm-hmm.
lot of D3 during the pandemic. And it helped so much. Building the immune system is important.
Yes,
And hormones
absolutely.
build the immune system. That supports the immune
Mm-hmm.
system.
One thing that I've noticed, because I was feeling really tired the last time I saw my GP, and it was not like, so normally I'm pretty high energy, and this was weird. So I had called ahead because I was due for labs, and I said, I want a complete panel of thyroid. I don't just want the TSH, I
Right.
want everything. Of course, I go in there and all I get is the
Oh,
TSH. And
the-
it infuriates me because I can
yes.
ask for that even if I'm in there with him, and that's still what he does.
Well, the TSH is only 60% accurate in terms of revealing abnormalities of the thyroid gland. So I look at the free T3, the free T4, reverse T3, and the thyroid antibodies to see if someone has an
Mm,
autoimmune Hashimoto's disease of
mm,
the. Listen, I'll write the prescription for you. I think you should have that done. I mean, Lynn, this is a
yeah,
serious offer.
yeah,
Really,
yeah.
it's. I hate it when doctors assume that kind of superior stance,
Mm-hmm,
because it's we're 100 years old in terms of Western medicine, maybe 120 years old. In 1900, we had no hormones, we had no antibiotics. It wasn't until 1920. So to have any kind of arrogance in terms of what we know and what should be absolutely done is not a good stance to take
mm,
for a doctor.
mm,
I mean, I personally highly individualize treatments. And I need to
right,
know, how they detoxify, and are they sensitive, and what is their main concern, and
right,
and obviously the thyroid is so important in terms of fatigue and memory and weight gain and skin texture and hair and just your brain in general. It runs
mm,
your whole metabolism.
right. And so, what happens to women when they've had a hysterectomy or even a partial, well, mostly a full hysterectomy? Because what happened to me was I had the hysterectomy, they refused to
Mhm.
take my ovaries. And so, a couple of years ago, I had to have my ovaries out.
Yeah.
So almost like going through menopause twice was how I
Right.
felt that was. But what
Right.
happens then with our hormones when we've had a surgical type of menopause?
Well, when the ovaries are removed, we go into an abrupt and profound menopause. So when I used to be a surgeon, I mean, I'm still a surgeon. I just don't do surgery.
Mm,
But when I was doing hysterectomies and laparoscopic hysterectomies, I would always make sure that the woman had that I knew her hormones before, and
mm,
depending on how old she was, whether that was an ideal state, which is about 35 to 40. I like to balance depending on how a woman was feeling at that age. Someone might be in menopause by then, but to a youthful level, her youthful level, and make sure she gets those hormones the day of the surgery. And then I recheck in 6 weeks and see how she's doing in terms of her hormones. And I think it's cruel and unusual, or maybe just very misguided, not to replace those hormones immediately and to check all the hormones to see how she's doing. So, did someone give you hormones back?
That's a very long conversation as to just exactly what I was put on. And
Oh.
so at the moment, I'm taking nothing, but realize that there's probably some depletion there, like I'm sure many of our listeners feel, especially if they haven't gone on to bioidentical hormones or something a bit more natural or homeopathic. I think if you know your body, you realize that, hey, this isn't how it should feel.
That is absolutely correct. And the sad thing is that, and I'm kind of saying it again because so many women are shocked when I say it, is that once menopause begins in our late 30s or mid 40s, then it stays there for the rest of your life with your ovaries or without your ovaries. But without your ovaries, it happens very abruptly. Now, it is common kind of not knowledge, but common sort of understanding that women should come off of hormones after 5 years. And I do not adhere to that. I individualize whether a woman should continue or not. Now, I'm 73 years old. I'm still on full hormones and I feel like I'm about 45, but it's because of the hormones. If I weren't taking hormones, I'm sure that I would feel, much more tired, much more brain fog. I would probably feel discouraged and feel like life didn't have much excitement left. And it just doesn't really get better. What happens is, so when we go into a deep menopause and we're not treated, the adrenal glands burn out.
Yes.
And what happens when the adrenal glands burn out is we stop having hot flashes. So a lot of women will say, "Oh, Prudence, I'm through that. I'm in postmenopause." It's like, well, I'm looking at your hormones, and your follicle stimulating hormone is 5 times higher than it would be if you were not in menopause. And you have all of these symptoms. It's just that you don't have hot flashes. And that means your adrenals are burned out, which they generally are when women stop having their hot flashes. So I just believe in correcting hormones at any age and to make sure that they're youthful levels and individualized to that woman. And I also like supplements, and I also do, naturopathic interventions. My daughter is in my practice, and she's a naturopath, and she's taught me a lot over the last 6 or 7 years about naturopathic medicine. So
Yeah,
it's it's
there's a lot more out there than we really hear about. Here in Florida, we can't have naturopathic doctors. It's the
oh,
craziest thing. And I'm sure some other states are the same way just because of
yes.
the health advocacy board that doesn't license people in different states. And it's very difficult because nor do we have functional medicine doctors anymore here in my area, at least.
Mm.
So this is why I feel that the talks that I have here on the podcast are so important and informative, because still there's a way to see the kind of doctor they need to see. I'm assuming that you do some web type
Oh,
conference with
yes.
people. Yeah.
Yes. Oh, absolutely. And I have a program where I'll take 12 to 15 women through menopause over a 10-week period. It's done on video, and it's a lot of time that I put into each woman. And she ends up with her hormones completely balanced, and she's part of the center. So she's part of the center. And so her thyroid is balanced, ovarian hormones are balanced, everything's balanced. In the diet, I really love
Mm,
detox and anti-inflammatory diets, and their gut is fixed and their mind is positive.
yeah.
So
Yeah.
I mean, I take care of people all over the world, and it would be very difficult to have them come in person to, so I
Right.
love that this came out of COVID.
COVID. Yes.
Yeah,
Yes.
it's just been kind
Yeah.
of miraculous that we
Yeah.
can reach so many people now.
Yeah. So, where is the best place for people to find you?
Well, my website is Dr. Prudence Hall, and that please, if you go there, I'd love to give you my book for free. If you put your email in, it downloads immediately to to your email, and then you have the book. And the first chapter is all about menopause, and then perimenopause, and then thyroid conditions, and then sexual issues. And so I just go through. And Suzanne Summers, bless her,
Yeah.
told me to write this book. She said, Prudence, you write this book now. Each chapter is a different patient that you took through that condition.
Mm,
So I think it's very informative, and I just love women to be educated about such
yes.
a critical process that they will
Yes.
be in for the next 40 or 50 years. And there's lots of ways to treat it. I mean, I personally think bioidentical hormones are one of the most advanced ways to treat it, but herbs and diet and lifestyle and women right off the bat, if you can't sleep, 5 to 10 milligrams of melatonin is very helpful at night. I would say 90% of women tell me they start sleeping better. Now, I
Mm,
make a combination called sweet sleep. It has GABA, 5-HTP, melatonin, and all these other things. But just simple melatonin will help. And to make your thyroid work better, selenium, you can have 3 or 4 Brazil
mm,
nuts, and iodine. That alone will help the thyroid, located right here in the neck, to work better. And anyway, I put all those hints into the
mm,
book, help people how to help be their own advocate for their own health. And I actually
yes.
this is what I gave that patient. These are the labs I did on her to make the diagnosis.
Mm, that's very helpful. I really appreciate this because I think it's a talk that needs to get out there into the world, have people be educated better for us at this time of our lives, because it's a crucial time. It's not like years ago when the average lifespan was 72 years. When we're going into menopause now, we're only halfway through our lives, and we want to
Absolutely.
do it just as you say, with this vitality, with this anti-aging. I mean, we don't want to be frail while we're
Mm.
going through this stage of life. We want to have vitality and agelessness, and on the inside as well as the outside.
Oh, Lynn, that's exactly right. To reclaim or to create the life that we need to have, the life that
Yeah.
we love, because we lose that in menopause, and there's no reason to go quietly into the night.
Mm,
We're
mm,
here with messages, and we help so many as women. We offer so much aid to so many different people, our families, our partners, our communities, the world, and we are a strong, loving voice. Actually, much more collaborative, much more loving than men. And not I love men, but just in terms of the difference is that we really are here to make a difference, whether it's with one person, whether first of all it's with ourselves. We need to heal ourselves first, don't we? Give to
right.
ourselves, give
Yes.
to ourselves during this time.
Yes.
Yeah. For the first time,
Yeah.
maybe give to ourselves.
Yeah. Thank you so very much. I appreciate you
Mhm.
joining us from sunny California
And sunny
and
Florida.
sunny Florida.
Mm.
Yeah, thank you so much. I appreciate all of your input. It's just been great and very helpful.
Well, thank you, Lynn, so much. I'm just delighted to have talked and to have spoken with you and to know you now.
Thanks. You have been listening to the Living Life Naturally podcast, where we're on a mission to inform, inspire, and encourage women to live their best life confidently, joyfully, and freely from what's been holding them back. For show notes and free resources, visit holistic-healthandwellness.com. And I'd be delighted if you'd follow us on socials to connect further. If you enjoyed this show, why not share it with your friends? If you found good value, chances are they will too. And of course, a 5-star review on iTunes is always greatly appreciated, as much as I appreciate you listening. So until next time, live life naturally and joyfully.